Now, the South African Medical Association is welcoming the lifting of mask mandates, but it's urging the public to observe COVID-19 rules in healthcare settings. It's also warning of vigilance after the first case of monkeypox was discovered in Gauteng. I'm joined by SAMA chairperson Dr. Mvuyisi Mzukwa. Thank you very much, Dr. Mzukwa, for your time here on eNCA. Let's start, of course, with the monkeypox issue. You say that your members and the public should practice caution. Yesterday, during the briefing, government officials in the health department kept emphasizing how the people who are prone to monkeypox are mostly gay men. But this doesn't mean that if you're not gay, you might not get it, right? That's not the correct way to look at it.
Good morning to you, Maseko, and good morning to your viewers. Maseko, I think we need to start right from there. I think it was a mistake to be saying that telling the public that this is anything to do with lesbian men or whatever the case is. This is a condition that is caused by physical contact. Whether that physical contact is done during sexual intercourse or in the normal course of people's activities, as long as it's contact, it has nothing to do actually with that. It might be discovered with those men, but it has nothing to do in terms of its transmission.
And talking about how it spreads and the transmission, we were told yesterday that it's not a fast transmission and that we should not panic. Do you agree?
Yes, I fully agree, because this is not a respiratory infection, as we noted with COVID-19. This, you need to have water that bursts out from the blister. And, if you come close, in close contact with that person, also the surfaces that may be contaminated with that fluid, then you may have a problem, in conducting the disease. Like we said, it's self-limiting, taking about 2 to 4 weeks. So there's really nothing to panic about. Usually also affecting children less than 17 years of age. But even any adult, especially those that have not received the smallpox injection or vaccine, that they are prone to contracting this virus.
Just tell me something. All these poxes sound the same to me, at least, especially in terms of the symptoms that I must look out for, Doc. I mean, for instance, chickenpox, also you look out for blisters that also pus and things like that. So how do you tell that this is different? And if I did have chickenpox, for instance, which we are told you can't get the second time, can I get monkeypox?
You can still get monkeypox. Remember, the viruses are not the same, even though their names look similar. But what you need to do in this case, whatever symptoms you have that looks like a chickenpox, you may need to seek medical attention. But this, the features in this one is the lesions are bigger compared to the chickenpox. They are about 1 centimeter in diameter, quite big. And also, you may also have swollen lymph nodes or glands in the neck. So those are the specific features, towards this. I mean, other conditions can do it, but if you have these, ultimately you need to seek medical attention so that you don't get complications, especially for people who are immunocompromised.
Can someone die from this if, for instance, somebody decides that they'll heal themselves from home and not seek medical attention? Is it possible that death would come?
Well, there's a very low death rate there, Maseko. It's about 1 to 10% of cases. Those cases would be people who are with underlying medical conditions. So, but we really urging everyone who is exposed or who might be displaying these symptoms to seek medical attention. Because at times you might think you are competent to deal with yourself, not knowing that you are dealing with something else. So I would really encourage people to go out there and seek medical attention if they display these symptoms.
You know, we're so used to, after COVID-19, of course, making sure that we don't touch germs, etc. And isolation was definitely, one big part of healing COVID-19 and making sure that it doesn't spread. What happens if a person, what advice would you give myself and the listener in terms of, as soon as you see your symptoms, before actually going to the doctor, what do you need to do? Do I need to isolate? How do I protect my family and friends?
Well, you can isolate, but the most important thing is that you need to wash your hands, making sure that your lesions, you're not touching, surfaces around you. But the important thing is you wash your hands, and also encourage your family members to wash their hands as well. And obviously, you wouldn't want to share stuff with them in terms of clothing and even bedding as well. Because you might get lesions or infection from that. So important to isolate yourself. But I don't think we should be doing what we are used to doing in South Africa, where if somebody has got symptoms, we stigmatize, those people. I think we need to get rid of that. We did that with HIV. We did that with COVID-19. This time around, we must stop it. We must learn that there are conditions. People don't invite infections. They just by chance get the infections, and we need to support them. Science is there to assist us. Healthcare workers are there to support us. Let us not deal with others psychologically.
Definitely, I like what you just said there, Doc. Let's talk about, the COVID-19 regulations and the fact that masks are no longer mandatory. Now, as SAMA, I know that you welcome this, but will you be, basically asking some of your members to keep their masks on in the settings that they work in?
Thank you so much for that question, Maseko. It's important that we remind our colleagues that we are not only dealing with COVID-19, we're also dealing with flu at the moment, but also we have a community spread TB, pulmonary TB or whatever TB you may think about. It's important that we continue to protect ourselves because, at the moment we've got people who are going around, with untreated, even uninvestigated cough. So we need to protect ourselves because we face patients with different conditions. They might not be willing to put on their mask, but at least on our side, we must protect ourselves so that we continue to provide service. We don't deplete the staff members who are already in dire shortages at the moment.
In terms of, Doc, I think, I just need assistance here and there with some of the things. So basically, if I decide to put on my mask, remember what we were told as South Africans who don't necessarily practice being doctors and the science and anything in that field. We were told by, researchers and scientists that the next person also has to wear their mask because the influenza you can also contract it basically through your eyes. If, somebody speaks and then maybe they spit a little bit into your eyes, you can get infected that way as well. So does it really help if I decide to put on my mask, but 10 other people around me don't have their masks on?
I think, they were saying in the Department of Health, it is important, Maseko, that if you are symptomatic, you consider other people around you. If I'm ill, I don't want my children to get ill as well. I don't want my fellow employees to get sick as well. So it is important, it's upon me to put on a mask. So we're saying the same thing to communities. In other nations like North Korea, Japan, when a person is symptomatic, even way before COVID-19, if you see a person in Japan wearing a mask, you know that that person has got a respiratory infection. So I think we've learned as South Africans from this pandemic that we need to protect each other. If I have flu symptoms, regardless of the diagnosis, I must protect somebody who's around me, including my family. So same applies with communities. You can't be going to church with symptoms and you don't want even to put on a mask. You can't be going to a party and not put on a mask if you are symptomatic. I think the problem with the respiratory infections is the droplet spread. that we need to curb, and we need to protect the people around us, and masks are going to help us with that.
Well, thank you very much for speaking to us there, Dr. Mvuyisi Mzukwa. He's the chairperson of the South African Medical Association.